As the NFL playoffs begin today, Miami Dolphins quarterback Tua Tagovailoa continues to recover from multiple concussions suffered earlier this season. What is a concussion? A concussion is a traumatic brain injury. The brain rapidly bounces back and forth inside the enclosed space of the skull. The brain tissue physically changes shape, which stretches and damages the brain cells, the neurons. This causes an electrical storm, which can be seen as an unsteady gait, shaking out the cobwebs, grabbing the head, etc. It also shortly causes chemical changes inside and around the neurons. Physical symptoms of a concussion can include headache, dizziness, nausea, light and sound sensitivity. Cognitive symptoms can include memory loss and attention deficits. Sleep dysfunction symptoms like sleeping too much, sleeping too little, trouble falling asleep, and emotional symptoms like anxiety and depression. There are 3 grades of concussion. Grade 1 is when the symptoms last less than 15 minutes with no loss of consciousness. In grade 2 concussions, the symptoms last greater than 15 minutes with no loss of consciousness. In grade 3 concussions, there is a loss of consciousness, even for a split second. The 2 syndromes that we always fear as physicians are number 1, post-concussion syndrome. This is when concussion symptoms last longer than the expected recovery time of 1 to 3 weeks. The second syndrome is second impact syndrome, where a second concussion and traumatic brain injury is suffered prior to complete recovery from the first concussion. This can lead to rapid swelling of the brain inside the enclosed space of the skull, which can be fatal. We wish Mr. Tua and his family well and a speedy recovery.